Hi students, welcome to week 6, Current Trends in Health Information Systems as we are transforming healthcare. We will be looking at student learning outcomes that will incorporate our current trends in health information systems and writing and leadership communication. So we're still looking at this leadership portion of the course. The student learning outcomes are to synthesize current trends in health information systems in the form of technology in healthcare project assignments. You're going to finish your assignment and turn that in by Sunday, and then you're going to discuss professional writing as a nurse leader, which is important because sometimes we don't necessarily always know how to address other peers or leaders, so it's good to have practice in a safe space. So our technology and healthcare project, you can see the purpose here. It's going to provide an opportunity to use that current problem in nursing and provide a potential solution. We've been discussing this for the entire course. So you're going to use your 4 data analytics evaluation components, and you're going to organize those along with a couple of other things, which we'll get to in a moment, into a video recording that uses a presentation software. The easiest way to do that is going to be through PowerPoint and ScreenPal, like you've practiced. But of course you can use whatever you want. You can use Canva, you can use Google Slides, etc. And then recording should be about 15 to 20 minutes and be engaging to the audience. So you don't want to really go over 15 per se, because then ScreenPal may, in your student version, it may cut you off at 15. So I would try to keep your presentation under 15 minutes. There shouldn't be that many slides, so I think it's doable. So try to stick with 15. If not, you may have to submit 2 video links. So just an FYI on that. Here are the expectations, which again, you've already done this. You've introduced, you want to introduce yourself, and you want to also introduce the title of the presentation. So a lot of you haven't had a title page with a title in your presentation so far. So please choose a creative title to talk about your problem. Background information, succinct summary of the background, the national patient safety goal that you chose and why you're using it, and the clinical environment that you're working with that in, that you've already talked about. And then the problem, you have a succinct summary of the identified problem, and that's shared. The significance of the problem, the target or goal, you've already addressed this, and we've given feedback back and forth. And then the data is clearly stated, so look at your data section, your results section, and you want to include a conclusion. So have a conclusion slide stating, overall summary of your project and a conclusion. Professionalism and grammar, you want to make sure it's clear, organized, free from spelling and or grammar errors. So use your editor, use your spell check, your all of those things, your Grammarly, whatever you use, to make sure that you shouldn't really at this point have any spelling or grammar errors. And then the APA formatting should be corrected by now. I've given you all information on how to correct those references that you've had, or how to correct in-text citations. You should have in-text citations on your slides. So if you are presenting something that has a reference that goes along with it, there should be an in-text citation on the slide. So if you have a bullet point here, in results, you would have, I'm just making this up, Henderson 2024, you would have that on your slide, because when we present to people, we want to make sure that we are showing to them who the information is coming from. If you only have a references page and you don't put in-text citations, then how do we know which reference goes with which material that you're looking at? So have those in-text citations on your slides. And then again, recording is within the 15 to 20 minute time frame. Again, trying to keep it closer to 15 so you don't have to stop your recording and start over again with a second recording. So that is what you'll be doing. That'll be due by Sunday, and you already have this done. So you're just going to put it into a good presentation format, and then you're going to record it. So the discussion board for Unit 6 is going to be practicing writing a mock email. And what I'd like you to do is look at this ta-da template, top line summary, action, the follow-up or recommendation, the details, and then using the attachments. So what you're going to do is you're going to construct an email to your leader asking for a self-care activity for your workplace. Use that ta-da template, and then include a link or a video or a website that you want to share with your leader on, either what you'd like to do or why it's important. And then you don't need to reply to your peers this week unless you'd like to. And there's no specific word count, because you always want to try to get your email messages across as succinctly as possible. So can you craft this nice email about a self-care activity for your workplace, why you're doing it, what would you like to do, and can you come across succinctly in your approach? So no replies to peers, no specific word count, letting your leader know what you'd like in a nice way. So review and complete the activities in Blackboard. Read Chapter 15. Chapter 15 is going to be a nice segue into our next mini, which is finance, if you haven't taken that course yet, 611 or 611. So it's going to be a great discussion into start off of the discussion of finance and healthcare. And if you look at those learning objectives, they're going to talk about structure for financing a healthcare system, describing the challenges within our existing financing mechanisms currently, conceptualizing the valuation of healthcare services and information technology infrastructure. So looking at how these are tied together and how our services can be, really valuable, made more valuable as well. Understanding how healthcare financing has affected our clinical function, which should be no surprise to all of us that healthcare has become more of a business model type of service, and how it's affected how we do things clinically, right? There is, an impact that has been made, and it's not always a bad one, but it is definitely there. And then we're discussing and assessing current financing and organizational models as they address cost, quality, and continuity of clinical services. So you're going to look up some of these new reimbursement-based models, such as the cost-based reimbursement, which is our initial form of insurance, started off around the 1920s, our capitation-based reimbursement that has also existed in the U.S., and then our value-based reimbursement that started in the 1980s with Medicare and Medicaid services using the diagnostic-related groups, or DRGs. So if you've done any work in utilization review, you will definitely understand the DRGs. And then we're looking at lack of coordination and information sharing, which is hopefully getting better with our technology that we've been using in healthcare, but maybe not in between systems. If, hospitals are in a system with outpatient organizations, it may be better. But as you know, if someone is using a large organization like UPMC, and then they're also using doctors at Allegheny Health Network, there may be a lack of coordination and information sharing. So just a quick review of what we're going to start to look at in the next course if you haven't already taken that. So check out Chapter 15. Get your quick email done in Unit 6 discussion. I did change it. If you had looked at it before, it's a little different. So I changed it to asking for a self-care activity for your unit, because I think that is one of the most effective emails you'll probably ever write if you are going to write any email and ask for something, especially considering how much it may cost to do some sort of self-care unit, self-care or approach on your unit. And then finish your project assignments and upload those by Sunday. So if you have any questions, reach out. You've already got everything done in these projects. It's just a matter of putting it into a PowerPoint and recording it and submitting it. So if you've been making the corrections all along with my comments, then you should have no trouble just catching up and getting this completed. So I wish you all a wonderful week 6 and look forward to your projects. Thank you.